take us typically the full hour. So welcome to today's event. I'm Jade Maloney, Operations Manager here at the Institute of Health and Social Care Management. I'm joined today on the screen by Tom Bell, who is Director and Lead Consultant of Cormetis. Tom joins us today to talk to us about the behavioural sciences and give us some new insights, skills and knowledge to recognise and combat willful blindness. Tom has developed a short course that dives more into this topic that I will link to in the chat if you would like to undertake that course at your leisure, all around how to speak up safely in health and care settings. Tom will also talk to us how to make settings more ethical and safer when it comes to organisational practices. Today is an interactive session. There'll be elements for you to get involved. So please, we'd love to see your faces if you can. Please use the chat box if you can't unmute, but we'd also love to hear from you directly as well. There'll be a short poll and there'll be some opportunities for you to share your experiences. We want you to get the most out of this session as possible. Tom's got some slides that he'll talk through with us today, and you'll get a copy of that after the session. We are recording. You'll also get a copy of that. If you've got any questions about distribution of the recording, I'll pop my email in the chat. Without further ado, Tom, straight over to you. Enjoy.
Thank you very much, Jade. Brilliant introduction as ever. Thanks to John and to the Institute for putting this event on. This is great, isn't it? Because we've got quality over quantity. So those of you that are here will hopefully remember this for a long time, and those people that didn't make it, you'll be able to go. You should have been there. So I will now start sharing my screen. Jade will keep me on track here in terms of whether or not this is working. Yeah.
It is. You're fabulous. Not in the bottom, though.
I'm not in the bottom. Whereabouts am I? Have I disappeared?
You're in the top corner, but that's fine. You're spotlighted, Tom, so you're good to go.
Thank you. Thank you. Well, this is the second in a series of 8 short bite-sized workshops, which have been designed to provide a combination of sort of valuable behavioural insights, some practical knowledge and some usable takeaways in easily consumable format. I would also really like these short sessions to be a springboard for thinking, because, thought-provoking, because I think an hour, as we all know, I really appreciate people getting this hour into their days, but an hour is not a great deal in which to cover some of the topics that we're looking at. So the idea is, if you can, take these, use them as a platform for thinking, and then we'll re-engage at the next one and so forth. So let's get these slides working, shall we? An introduction to willful blindness. Quick agenda. We're going to do some quick intros in a moment. Briefly talk about the behavioural science. We're going to get into willful blindness. You may think that fourth bullet point, what do you mean you didn't see the gorilla? Some of you might have caught on to what that may be already, especially those who've been to see Derren Brown. Then we're going to talk a bit about ethical fading, which is very closely related to willful blindness. I'm going to talk about the myth of the curved ball. Then we're going to get to the bit about how we can create willful awareness, so the flip side of willful blindness, and we can address some of that ethical fading that I'll highlight. And I've got some key takeaways, some suggested reading, and we will hopefully have time for discussion, Jade, yeah? So who is in the room today? Shall we just have some quick intros, or do you want to do a poll, Jade? What would work best for you?
Should we do the poll so we can gain how much experience that you've got within health and social care? I think that would be really helpful to get us going. So it's coming up on the screen now. You just need to select how many years that you've got. It's anonymous, and then we can see the results.
Lovely. I will stop sharing so we can just...
I can see those are coming along screen now. Lovely. So it's looking like 80% of us are 10 plus years experience of working within health and social care. I think we've all responded to that poll now, have we? Just having a look how many we've got on the call. Yeah, so we've got lots of experience on the call today, Tom.
Fantastic. I see we've got one relative newbie, 1 to 5 years, yeah.
Well, that's me, but it is 5 years. As opposed to 1 year.
I was going to say, I love that stage of being in the NHS between 1 and 5 years, because right up until sort of 3 years, I played the newbie, the person that could ask the questions that I said I didn't know the answers to, and I managed to get away with it. So I don't know if you're still managing to play that card, but thank you very much for that. That's great. I will nip back to sharing my screen, Jade. Yeah. And we will. Has that come back up as it was?
Yes, fabulous.
Wonderful, thank you. So, behavioural science. So there's the kind of dictionary definition, if you like. And one of the things I'm going to touch upon here, this is a really short bit on behavioural science. So please don't be too disappointed if you came purely for the behavioural science piece. I'm more than happy to take that further either afterwards or in person if you wish. But the reason that I want to highlight behavioural science is I'd like you to think of all the reports and inquiries into all the many incidents, whether it be into health, publicly funded health, privately funded health, whether it be into things private sector such as Volkswagen, the Volkswagen emissions scandal, etc. The reports and the inquiries that emerge from those things, to the best of my knowledge, and I have read most of them, I have to say, none of them refer to the behavioural sciences. And that fascinates me because when we talk about behavioural sciences, it's the presence of those that actually shapes our behaviours, our responses, our actions, and our thinking. And if you think about what an inquiry and then the report is set out to achieve, it really sets out to achieve what drove the behaviours, the responses, the actions, and the thinking within the individuals, within the teams, within the organisations and the systems that are currently the subject of inspection. And it's fascinating because behavioural science and the issue of willful blindness doesn't feature in any of these. And as we go through this, you'll start to question why that is. And there isn't an answer to that, by the way, but you'll start to see that actually many of these inquiries and reports would do a whole lot better if they did focus on the behavioural sciences. The response typically is, and as we've seen, Francis was a great example, wasn't it? We had a massive lengthy report with 299 recommendations, and everything was seen to be something that could be fixed in a legal framework. It could be fixed with a new criteria or with a new definition or with a new set of standards. And I think we've seen how that actually doesn't work in reality. So behavioural science, it's the study of human behaviour through observation and experimentation. I find it absolutely fascinating. I would say that. I'm currently a PhD student, so I'm thoroughly enjoying it, I have to say. But if there is a phrase that sums up both what we do and what we don't know about behavioural science and the human brain, this is it. Now, this, I should say, was given to me by somebody while I was working in an NHS mental health trust, so I'll give the credit to them for that. And I think that's the state that we exist in, isn't it? So please just take a few seconds to register that, let it sink in. It's kind of funny, yes, but it's very real as well. And this is the reality of our existence. The human brain remains the most complex mechanism in the discovered universe, yeah? I think there's apparently, I don't know who's counted them, but there's apparently 86 billion neurons that are doing their thing up here. Estimates vary, but it would take the average person 95 years to count to 1 billion non-stop. I don't know if that includes sleep or not, by the way, or weekends or lunch breaks off. The purpose of this session is to talk about willful blindness as a product of and an aspect of the behavioural sciences. We don't have time, as I've said, to cover the full behavioural sciences in detail. However, at the end of this workshop, I will provide you with a list of some very readable and listenable books for Audible fans that I think you'll find both fascinate you and enrich your understanding of human behaviour in a way that you can identify with and use. Out of interest, you don't have to answer this question, but it's just something to think about. Before we go any further, just consider how you think someone who feels they are intelligent, that might be you right now, by the way. Certainly I felt challenged when I first kind of read that. How do you feel that people in certain positions of authority who are intelligent, motivated, knowledgeable and driven would feel on receipt of this message? Because essentially what that's saying is you do things that you don't understand why you do. And we may never understand why you do them, yeah? And I think to look each other and ourselves in the eye and say, we will never understand ourselves or those around us fully. And the best that we can hope for during the course of our lives is a partial revealing of this, yeah? I think it's quite the acknowledgement, isn't it? It's very humbling. And it's not always a comfortable thing to acknowledge, I think, especially when you're surrounded by senior people of certainty. So, willful blindness, what it is, how it manifests, and why it matters. Anybody in the room come across this term before? Anyone familiar with it? Anyone perhaps read the book about it? I think it's a slightly misleading term, and the reason I say that is that the use of word willful suggests that we do it purposefully, consciously, knowingly, but that's generally not the case. I first came across the concept many years ago as a result of what was going on in my own life and my work as a small business advisor. And when I stumbled across Margaret Heffernan's book, it just leapt out at me. It was as if, when somebody finds that memorable way of verbalizing what you're thinking but can't express, and Margaret Heffernan managed to bring to life brilliantly what I was thinking. It was one of those moments where you realize it's not me. So in her work on willful blindness, Margaret Heffernan, she makes the powerful and useful observation that organizations that are safe and that thrive in competitive, dangerous or risk-laden industries, they are the organizations that are both internally and externally well connected. So these are organizations in which information flows freely. And as we mentioned briefly during last week's session, the CQC, that's one of their criteria, isn't it? When they're looking at an organization and whether or not it's well led, one of their 8 criteria is that does information flow freely throughout this organization? And Margaret Heffernan makes the point that you will be a much less willfully blind organization. In other words, you'll be more willfully aware if you can create the conditions in which information can flow freely in and out and around the organization. Many of us will be aware of these well-publicised recent events and the ongoing inquiries into them. Certainly, I was asked recently to input information into the Thirlwall inquiry, which is ongoing. All of these are largely the product of willful blindness in one form or another. Willful blindness really is that important and it's that prevalent. And it's not just the public sector or the NHS, no organisation is immune, and it's not for the lack of published values. Every single one of the organisations in question, those highlighted on that slide, they were awash with printed value statements, But values only exist when they are lived. New sets of laminated values and strategies are not the answer. In fact, I think they may be part of the problem, because I think we have had so many now that some people disengage. And I think when these fail to lead to any meaningful change, it makes it harder for the next initiative to gain traction. So the more we sort of disappoint by issuing new statements, new sets of values, new frameworks, new strategies, we just we create this industry, if you like, where people just go, oh, okay, I'll play along with it, but it's, it doesn't actually mean anything. Now then, I'd like us to have a quick discussion. I'm going to stop sharing the screen in a moment. This phrase is, we see the world as we are, not as it is. I'm sure somebody said that originally, but I don't think it's attributable to anyone in particular. It's evolved and come down over the centuries. Stephen Covey used it, and A. Nin used it. But this phrase and the revelation that contains within it, it turns the notion on its head that seeing is believing, It is in effect saying that believing is seeing. And willful blindness is a form of that. So we frame and interpret what we see through the perceptual lenses that we've acquired during the course of our lives, and the perceptual lenses that we have acquired and are shaped for us in the organizations that we work in, often unknowingly. And sometimes we ignore things deliberately because we choose the lens that we view the world through to suit our needs at a particular point in time. I'm just going to stop sharing the screen here and ask for any comments on that. Any thoughts from anyone that we see the world as we are, not as it is? Anyone like to leap in, raise a hand? You're either...
We've got Anna.
Yeah.
Well, that 2 people can have the same conversation, third person can observe, and if you ask all 3 of them afterwards, it's like they've been in completely different rooms. Because if you're already feeling a bit, it feels more like they're attacking you, or, well, actually, I was just saying, and it's where you're coming from to start with. Depends what you take away sometimes, I think.
Absolutely. Context is really important, isn't it? We had a young lady from the NHS Leadership Academy. I'm not sure she's on the call today, but she was on the call last week, and she'd had this particular occasion where she was trying to implement some change within an NHS trust, and the change was supposed to be implemented within a matter of months. And there was this sense of disappointment on her part that she hadn't been able to achieve this. But when you explain actually that context is everything, that the people that she was trying to communicate with and make the changes upon, they would have a perception of where she was coming from and whether or not it was important, whether or not it was just a flavour of the month, whether or not it was going to be high on their agenda, and all those other things. And it's not, it is, isn't it? That context is absolutely vital. Jacqueline, do we call you Jackie or Jacqueline? Which do you prefer?
Jackie's fine. I just, what as you were talking, just related to a new sort of concept that I've been made aware of recently is sort of from the OK corral, and that kind of if you're not okay with me, and I'm not okay with you, you know, where you see these conversations from different perspectives, and when you need to be in that sort of green area where I'm okay and you're okay, to have that healthy position of a conversation.
That feels a little bit like, doesn't it? I don't know if you remember a book by, it's an oldie but a goldie, I have to say, by Eric Byrne called The Games People Play, in which he talks about those 3 states of, you know, communicating, where you either communicate as a parent, adult or child, and how you receive what you're given then helps determine how you respond to it. That sounds quite similar, but I'm going to, the OK Corral, I like that one. Thank you. Yeah. Natalia, is it?
Yes. I don't know. Camera is.
There we are. There we
sorry,
are.
I'm a little
Hello.
bit. Yeah. So what I want to say, I found I've been working at different trusts, and I develop, I would say, good eye to spot things which is wrong, because if you're moving around, you need to adjust constantly. And I developed my own guidelines. It's not my own, but they're much stricter than people who work in the same trust for many years, because they can't spot the mistakes. They just work there, and the way they do things, and it seems normal for them. They don't I don't know how frequently they do audits or going around and acquire new skills and compare yourself to others, especially in remote areas. And I found very difficult to adjust. And I had examples, like a simple example, when I work in a burning unit, so I know how you manage burns. And then you arrive in emergency department, and the nurse who worked there for 20 years, and she was deroofing all burns, and she saw me advising not to deroof it because infection can get. She was shocked. She returned the patient. She made a lot of alarms. And apparently I was defended by my colleagues and said that this is how we do it now. So it's a many situations like that. That is one example. Very clinical, but it's a more obvious when it's non-clinical, and how you approach and see things. Because if you work in the same place, you know, and you only learn when you're out of comfort zone. And if you have 20 years, it's quite a comfortable zone for you to be. It's what I think it's a danger lies. Yeah,
it's a real challenge. Thank you. It's a great point, and you've actually, I think you might have seen this presentation already, because you've sort of taken us in the right direction here. And it's because we're going to step into ethical fading. Well, I think some of what you're talking about isn't ethical fading. It's actually just perhaps being behind off the pace in terms of using old practices, but certainly ethical fading and acceptance of a gradual decline. I think it creeps in very easily, doesn't it?
But it also acknowledges, and have we done it for so long wrongly? And they just accept their own mistakes, and then why we were doing it, what is it, and it digging in, and it just open up so many Pandora boxes, and it's better to keep it closed, because you know, it's a new policy need to be changed, or people need to be changed because they're in the wrong place. And so this is how I see things. Yeah.
You're absolutely bang on, and you're right into the territory of the behavioural sciences, because actually it's that ability to accept, isn't it? It's a new policy won't get them to accept that, a new framework, a new strategy, but actually it's addressing them at a human level, you know, with empathy and with understanding that will make the change. Shall I'm going to pop on to the next slide, or any questions before we just pop on to the next slide, or are we okay? Okie dokie, right, let's do that. Thank you for those contributions. That was very, very useful. So Just to bring things to life, because I think it's always useful if you can relate these things, isn't it? You might recall this slide from the last session, if anyone was there, and I used it to illustrate the gap between reality and knowledge. I think one of the roots, and it's not the evil twin, but I think it's the inseparable twin of willful blindness, is misplaced certainty. Yeah. Mark Twain said, it's not the things we know, it's the things we know that just ain't so. And thinking you know what's going on, I think, is a big part of the problem. And when you look at that, I'd like you to just look at that slide. That's actually taken from the Countess of Chester Hospitals. And it's at the height of what, at that point, the Trust didn't yet know what was going on, or what the Trust said it didn't know what was going on. And I guess the truth of that is still to come out. But what you can see here is this complete disjoin between the experience that people were having on the wards. This is the hospital where Lucy Letby was. And so the experiences that are happening on the wards for the service users, the patients and the parents, and the clinicians who are trying to address this, is vastly different to what you see there. What we have is a board talking about becoming a model hospital and having management processes that were robust and recognised in the Trust of the Year category at the National Patient Safety Awards. That is such a disjoint, isn't it, between the reality of people's experiences. And I think it was Anna who just said, forgive me if I've got this wrong, but I think it was Anna who just talked about you can sometimes watch a conversation, going on between two people, and then everyone emerges with a different perception of it. What you have here is something really similar to that, but these conversations are going on in different places. And so there's a sense that the organisation has become willfully blind to what's really happening. So let me tell you a short story about the board meeting minutes, because I'd like to bring to life how willful blindness can emerge, in a very practical way. So those of you that remember the Shrewsbury and Telford hospital tragedies that occurred there on maternity wards, the board minutes and the papers for Sath Hospital, right at the height of what was happening, the board papers, one of them contained over 1,300 pages. Just for a second, just 1,300 pages for the board to consider, to be dealt with in a 3-hour meeting, which was held bi-monthly, with around about 2 weeks' notice at most. What's happened here is that you've effectively overloaded people with information. The board, who were hired for their intellect and experience, just as they have been in every other trust or every other public institution where there's been an issue, the board have been hired for their experience and their expertise, but are now overloaded with so much information that they've become overwhelmed. What happens in those situations is, it's into the behavioural sciences here, we defer to the people in the room that we trust and who we think will know. So if you throw 1,000 pages of board meeting papers at me a week before a meeting, first of all, I might just get a chance to skim read them. That's fine. I think if you ask Google how long it takes to read 1,000 pages, it's something like 40 hours. I don't think of non-exec directors and directors have 40 hours to spend reading papers. What you're then asking those people to do is digest them, take them on board, understand the consequences of, etc., etc. So what's going to happen naturally is the board's going to meet, and during a 3-hour session at which you've got, say, 12 people who are all supposed to discuss 1,000 pages of content meaningfully, or say they've looked at it, they're going to look to the people in that room who have certainty, and so they're going to look at the chief exec, probably they're going to look at the chair, and so in theory these boards are equipped to do their jobs, but the way they're structured and then actively managed and how information is fed to them and the amount that's fed to them means that they are reduced to what Nicholas Taleb, and those of you who haven't read any of his books, by the way, brilliant, Nassim Nicholas Taleb, he refers to them as IYIs. It's a slightly derogatory term, so forgive me, and it's his term, not mine. Intelligent yet idiots. And he stresses that it's not their fault for acting poorly because they are intelligent, but what happened is they've been put in a situation where they've just too much information for them to take on board. So all the ingredients were in place, but you've got the other things lying behind that, such as the new chief exec who's keen to please, an existing chairman who wants to be pleased, etc., etc. So all the dynamics are in place for willful blindness to emerge. If we could, would you be okay briefly just having another quick discussion about that, folks? using that as an example and looking typically at the way NHS trusts are structured and the way the boards meet, the number of pages they have to consider. Is anyone here surprised that willful blindness emerges because of information overload? Any thoughts on that? Hello, Joanne.
Afternoon. Oh, I think my little window was shut. There we go. Afternoon.
Hi, Joanne. I'm so pleased to see you, by the way, because it means that I didn't do such a bad job last time that you came back this time. So thank you.
Back. Yeah, on that point, one thing we're looking at, I work in a mathematical modelling unit and analytics, and one thing we're looking at is the quality of data and data insights that are in board papers. And yeah, I completely agree with you that the volume of material these execs must have to get through, and then plus when people possibly don't have that ability to get the data in there and draw out correct insights from the data, it must make their jobs virtually impossible to have to go through that volume of data and also the volume of text, and also try and extract insights from data which isn't necessarily laid out very well.
I think there's also something as well, isn't there, about human behaviour when you're in a group of senior people. So I remember this when I was a school governor, and long story, don't know how it happened, by the way, because I've got no children, but I got roped into being a school governor for 8 years. And I noticed that one of the things that would happen is very few people would ask questions. So actually you sort of doffed your cap to the head. So the head of school would say something, and you could be that person that maybe asked a question 3 times during a meeting, at which point you could start to see people sighing if you put your hand up. It's kind of, oh no, that not Tom again. No, he's asking. Oh, it's going to be another awkward question. But isn't it fascinating that it's the awkward questions, isn't it, that provoke the thinking?
Yeah, exactly.
But what we got into was just this habit of rolling through the minutes. Reading the last minutes, rolling through the agenda. Yes, we've got a policy for that. And off we would go. And it is fascinating. I think this is how sad I am, but I've looked at the number of pages that many NHS trusts use in their board meeting papers, and it generally runs to around about 300, and you just think, no, it's not manageable. If I use a slightly unfair analogy, Carlsberg's annual general meeting last year, 4 pages. Now, sure, there was stuff behind it, but what the point that's being made is, here's the stuff to focus on, folks. Yes, there's other stuff going on, but this is the stuff to focus on. Whereas I think what we've got into certainly in public service is there's so much going on and so much to monitor that we have to show we've looked at everything. And I think by demonstrating that we're showing that we're looking at everything, we often fail to look at everything, if that makes sense. So I will, I think, are we okay for time, Jade? I will just go back to sharing slides. There we are. Has that come back up all right?
It has, yep.
Wonderful. Has anybody been to see Derren Brown? Anybody? Shout up if you have, please. No. You may have seen this. If you haven't seen this video, I didn't want to do the video today because generally video from YouTube always makes a mess on Teams and everything goes, goes south. This is an experiment that's been going on for many, many years, and it's done in numerous formats and different ways. And you can see, looking at that picture there, you can clearly see a person dressed as a gorilla walking through the middle of that group of people. What might surprise you to know is that half the people are exposed to the test, and the test goes like this. The video is played, and people who are watching the video are asked to do the following. They have to count the number of passes. Think of targets here, have targets in the back of your mind. They've got to count the number of passes going between people with white shirts. So that, in other words, there's a focus. So they're focused on that. And what happens is the person in the gorilla suit walks through the middle, beats the chest, wanders off. Less than 50% of people watching the video see the gorilla. I don't know if you can believe that. It's absolutely true. My wife and I went to see Derren Brown, the illusionist, many years ago. And he does a very similar trick, which is it's a derivative of this same exercise, where he holds everybody's attention at one side of the stage, and he's doing such intricate things, and he's talking, and he's asking you for your attention. On the other side of the stage, somebody comes out dressed as a gorilla, beats their chest, wanders around the stage, literally hands in the air, you know, super obvious if you're looking for them, but of course we're not looking for them. And then after that's finished, Darren Brown asks the audience, did anyone see the gorilla? At which point you could see everybody's looking at each other going, what's he on about? And then, of course, he shows you a video taken in real time of the video coming out, of the gorilla coming out, clearly in the video, and nobody sees it. And that's because your attention is held in other directions. And interestingly, this even applies to clever, intelligent people, because we always think, don't we, that wouldn't apply to me, wouldn't happen to me. This abstract is taken from a 2014 paper by some academics called Drew, Vo and Wolf, and it's based on the USA's National Library of, it's housed, I should say, on the US National Library of Medicine portal. It's part of their knowledge base, and the paper is called The Invisible Gorilla Strikes Again, Sustained Inattentional Blindness in Expert Observers, yeah? And you can see there how many, right, it's a different trick, but it's done in a similar vein, yeah? 83% of the radiologists, admittedly fairly small sample size, but the vast majority of those radiologists did not see what had been placed in front of them. Willful blindness, willful blindness. If you've heard the phrase for the first time today, I'd be surprised, but if you have, what I use it as a useful catch-all. I call it a suitcase phrase. Some of you may be familiar with that idea of the suitcase phrase. Suitcase phrases are those things that we use that can kind of house pretty much anything, literally like a suitcase. You can put what you want in them, yeah? Whichever, we just call it clothes, and we put whatever clothes we want in them. We're not too specific about it. I think it's a wonderfully descriptive, simple to remember bit of terminology that encompasses a lot. If you look through some of those things there that would generally fall under the umbrella of willful blindness, and if I can take you back briefly to the events at the Countess of Chester, and let's recall there, for those of you that are unaware, there's a guy called Sir Duncan Nicol. He was the chair there. Now, he's a former head of NHS England. So the potential for what we call authority bias, i.e. they must know what they're doing, yeah, that would be off the scale. So you can sort of see why people were looking in the wrong direction, because you'd be looking at Sir Duncan and you'd thinking, former chief exec NHS England, what could possibly go wrong on such a person's watch? Quick question, if I may, what else do we think willful blindness might be called, and what are some of the other reasons that you think it might manifest? Any thoughts? Is anyone here familiar with any other terms that you might think would sit underneath that sort of willful blindness umbrella, if you like? That Lisa, I can see you nodding there. Sorry to put you in the frame, but
yeah, it was the the bias one.
The authority bias.
Yes, like you were talking about. Obviously, you know, you just go with the majority vote or whatever your boss or the boss is proposing. Although we did a bit of work in one of the services that I worked in around about respectful challenge. And that became part of our, if you like, rules of engagement at our senior team meeting.
Yeah. That respectful
with eliminating that.
That sounds great. And that respectful challenge thing is a bit, you know, the company Intel, very successful company, yeah. And I think it was a guy called Andy Grove who set that company off, and he introduced this concept called listen, challenge, commit. And he, you know, it was he would actually encourage people to challenge, and if meetings continue without challenge, they'd be stopped. And in fact, Alfred Sloan, who was the old head of General Motors, he used to literally have this practice whereby he would say to people, if we're not disagreeing, then we're going to stop the meeting, because we're all highly paid people and we're all here to share a view. So if there's no disagreement in the room, then there's no thinking in the room, yeah. What's the old thing, you know, if everyone's thinking the same, then nobody's thinking. And that, I think that respectful challenge piece is great, isn't it? Because we were talking last time, weren't we, about hierarchy and how we do sort of defer to the hierarchy. And yeah, I think that as a framework for a meeting, if you incorporated, you know, respectful challenge along with techniques such as the empty chair that we talked about last time, brilliant. You've got some really, that sounds like a great tool. Anyone else before I go on and reshare where we're at? Let's have a look. So you can see willful blindness manifest itself in many different guises. I said I was going to tell you a bit about ethical fading, and I think it was Natalia who talked about how people being in a comfortable place for 20 years can be detrimental. It can also be good. I have to say there are some plus points to that, but I would agree. I think it can be detrimental when it becomes too comfortable. So what is ethical fading? Where does it lead? And what does it look like in action? And so what we have here is, some of you, I think, will have watched the Panorama documentary about the state of services at the Greater Manchester Mental Health Hospital. It was aired on the BBC, I think, in autumn 2022. And you might recall a scene, and if you haven't recalled the scene, this might remind you of it, where a nurse has been, she's asleep outside in the sun, for quite some time, yeah? And she's obviously being secretly filmed by the undercover reporter. Now, as she's sleeping, another employee from the trust walks along the fence. It's a sort of administrative stroke managerial person, doesn't look clinical, but might be, who knows, who walks past. I think they're carrying some paper, and they don't say anything. They don't look. Nothing is then reported. No issue is raised afterwards. And there's also a fascinating scene there where there's a sequence where the newly hired care assistant, this is the undercover reporter, he's asked to falsify his check sheet to say that he checked on a patient when he wasn't there, just to tick the box and keep everybody happy. Now, a couple of thoughts here. You can see there that piece about the standard you walk past becomes the standard that we and others accept. I think there's a great deal of truth in that. If people see it's okay to do that, then it escalates and it gets worse. And actually the slide gets steeper and steeper until it becomes harder and harder to address. I'm going to make an educated guess, though, about what was going on at the Greater Manchester Mental Health Hospital, based on my own experiences with what happened to my sister in the mental health hospital in North Cumbria. And that is that what you could see going on was just the tip of the iceberg. Because I think once standards have slipped that far, overtly and explicitly, there's probably more going on behind the scenes, which we may never know about, might not want to know about. Maybe we should want to know about it, but you can bet your bottom dollar, if the evidence was so clear and the culture had got to the point where we just let people do what they wanted, then what else was going on is probably beyond our imagination. And the reason I can say that with some degree of certainty is that for those of you slightly longer hands here, in the year 2000, going back that far, something called, I think it was the Health Improvement Commission, or the Commission for Health Improvement, was launched by the then Labour government. And this is the predecessor to what we call the CQC now, yeah? So it was the predecessor to the Care Quality Commission. And the Health Improvement Commission was called into North Cumbria Mental Health Hospital because there had been reports that elderly people had been left without food, they'd been left outside in the cold, they'd been washed in baths with their own dirt and feces, some horrendous practices going on. And in fact, there was a report of people being tied to a mechanism that tied them to the commode so they could be fed on the commode and controlled. The Health Improvement Commission got involved. The report was discussed in Parliament. There was a lot going on there, a lot of horrific stuff. And I think the chairman, the chief exec, they were sacked summarily by the health secretary, Alan Milburn, who is now back in a position of influence. What's interesting, though, is that the reaction of staff to that report was just, so what? And the reason the reaction of staff was, so what, is that they knew more was going on. They knew that explicit abuse that had been identified was the tip of the iceberg. They knew that the sexual abuse of patients was going on. So if you say to somebody, and I know this is horrific to listen to, I appreciate, but if you say to somebody, oh, isn't it terrible that the trust was not feeding, elderly people properly? It was dealing badly with dementia patients. It sometimes left people out in the cold. But the people that you're telling that to, they're aware that actually there is sexual abuse going on the wards. They're just going to look at a report about that and go, so what? You're just scratching the surface. And so I think when Tom Peters, we're going to talk about Tom Peters in a moment, but Tom Peters uses a lovely phrase. He says, if you think everything's okay, then you're probably not looking hard enough. Some people call that a little bit cynical. I for one, get it. I know where he's coming from. He's not meaning that it's always intentionally something bad going on. But if you think everything's okay, then you probably need to start looking around. The myth of the curved ball. What does he mean, the myth of the curved ball? If you look at us, hark back to those slides that we pulled up earlier and some of the events, the tragedies, the organisations and the scandals that they highlight. What happens is during a report and an inquiry, we rationalise everything afterwards. And what we say to ourselves is we're not rational beings, by the way. Let's get that out on the table. There's a bit more behavioural science for you. We're rationalising beings. Yeah, we don't so much rationalise going forward, but we look backwards and rationalise our behaviour. And so the temptation and the convenient reasoning after an event has occurred is that it was a curved ball that nobody could possibly have seen coming. And we go, oh, isn't hindsight wonderful? If only we knew. Now, Nurse Lucy Letby may be one of the exceptions that proves the rule, but I've studied the context for most of the healthcare tragedies we are all familiar with, as well as many of the corporate scandals of the last years. And there are cultural characteristics and patterns of behaviour that are clearly visible to anyone with a mind to look for them. You know, and when things go south, it's generally the predictable, even logical result of everything that's gone before. So most of the reports and inquiries into significant cases of wrongdoing or avoidable tragedy, they could all be categorised under the single heading of should have seen that coming, because the curved ball is a myth in most cases, not every case, but the curved ball is a myth in most cases that we use to excuse what we should have seen coming but chose not to see coming. Said I was going to talk briefly about Tom Peters. Some of you may know who Tom Peters is. For those of you who don't, he's a well-respected management guru. There aren't many of those around, by the way, but he's a very well-respected management guru and writer who wrote some fabulous books. And one of the books that he wrote, In Search of Excellence, he wrote books to follow that up. I think that was one of the world's best sellers, actually, In Search of Excellence. Best-selling management textbooks, I should say. He used this phrase, excellence is not an aspiration, it's what we do in the next 5 minutes. Excuse me, I'm just going to take a very quick sip of coffee. What he meant by that was, we can all wait for a strategy and a plan and a framework to come out. And we say to ourselves, oh, when the new strategy comes out, everything will be all right. It'll be great. It'll solve this, won't it? The point he's making is that if I use some examples that you may know about, so whether it's Tesla electric cars or whether it's Apple products, whether it's, AI, yeah, which seems to be getting cleverer and cleverer all the time. These things were built on the backs of other things. Yeah, their rise to where they are now was actually incremental. The iPhone is the result of 30 years of tech behind it. Yeah, 30 years of technology, some of which people thought wasn't useful for their purposes. So when Steve Jobs came along, what he did was he took things like touchscreen technology, which already existed but hadn't been used to that degree. He took other technology, combined it, and used it as innovation. And that's what innovation is. It's the combining of elements together in a new way. So what we think are overnight successes actually came about through incremental steps, changes. And that's the point Tom Peters is making. If you do the right incremental steps over a period of time, then excellence naturally emerges at the end of that. And excellence is an ongoing product, isn't it? Yeah. So it's something that you continually build towards, as well as something that continually emerges. So excellence is a product of combining and building on everything that's gone before and continually looking at what you're doing in the next, not literally 5 minutes, but the next available chunk of time that you've got to do something. And this ties in very nicely with ethical fading, because excellence in the case of Greater Manchester Mental Health Services wouldn't have been walking past someone sleeping. Excellence would have been pulling them up on that. That might sound awkward and difficult to do, and there are ways of doing that. And I think, Jade, there's some great people at the Institute who are doing courses on having difficult conversations. But that's what it is. It's about not walking past what we might not want to see or what we don't think is acceptable for the people that we love, and it's challenging it. Now then, if that's true, this is also true, and I won't read this out loud to you in its fullness, but I'll sum it up. If what Tom Peters is saying is correct, then worryingly, but also incredibly usefully, yeah, the opposite is also true. So when I talk about those events that we talked about being largely the predictable, almost logical result of what's happened before, they are the result of willful blindness and ethical fading, which comes to a point where tragedy and avoidable harm then emerge. Knowing that, though, is incredibly useful, because if you know that the curved ball is largely, and I stress largely, a myth, then it means you don't have to be at the mercy of the unforeseen curved ball. It means that if you choose to look in the right places and ask the right questions, you can actually prevent these things from occurring at all. So there's the question. It's not, are we willfully blind? And I use that as an individual, at a team, at an organisation and a system level. The question is, the honest question to ourselves is, how willfully blind are we? And what can we do? And what are we doing to ensure we become as willfully aware as possible. And if you think about the intent, for those of you who are working in the NHS, if you think about the intent of PSERF, for those of you who work outside the NHS, that's something called the Patient Safety Incident Response Framework. The intent of PSERF is to bring knowledge together, to help organisations understand the issues that are facing them and where they should place their efforts, rather than having a one-size-fits-all response to every type of incident. So the intent of PSERF, I think, is good. Whether or not it works, that the jury is still out. So it's being active about reducing your willful blindness, because it won't happen by accident. It doesn't happen by accident. One of the things I've done with the Institute recently was created a course on questions, talked about creating a course on the power of questions. And I use this in the one about willful blindness that's already online. Questions are so powerful. The power of questions cannot be underestimated. In my online course, I refer to a crib sheet of a dozen questions, which you can, use to suit different situations. The power of a well-timed, well-placed and well-thought-out question, and building on Lisa's point about, that respectful challenge, questions can sometimes be seen as that. So, context is vital as in all these situations, but the power of a well-placed question is, it can change things. It can change the way people look at a situation. And that, I think, is sometimes the first shift, is to change where people are looking to reduce the levels of willful blindness that exist. This is the cover sheet of a report. I think it's actually the report that cost me my job. That's another story for another day. It's the second annual report that I produced for the trust that I worked in, and you can see that it's marked for internal use only. I was a chartered marketer for 20 years, and for me, the gold dust is in hearing everything. The gold dust is in often hearing the things that you might not want to hear, perhaps from people that you would normally choose not to listen to. But that's where the gold dust is. Every good marketer knows that. And those of you that know how a pearl is formed and why this phrase, the grit in the oyster, is useful, is that a pearl's created when a foreign body enters a mollusk. Yeah? And what the mollusk does is it deals with the intrusion by forming a layer of tissue cells around it. And that process is repeated many, many times, which leads to the creation of a pearl. So you've got something of great enduring beauty that emerges from recognizing, embracing and dealing with and addressing the unwelcome. Yeah. So there are all kinds of tools that you can apply in this way. Some of you may have come across things like CRM, customer relationship management software, or multi-channel listening systems, consistent tools for reporting and collating. Now, essentially that report was my way of asking questions, and that report was circulated to chief exec, chairman, all directors, all non-exec directors, and it was a foundation trust source of the board of governors, as well as senior managers. And it was full of questions, hopefully asked respectfully, but I was asking the questions in ways that would make readers think differently about the challenges facing the organisation. And I would frame things from other perspectives, and I would use quotes from outside sources to bring the issues to life. Because the purpose of those reports was to surface the issues and make things visible that previously hadn't been. And I think that's what good reporting does. I think it surfaces issues and makes things visible that previously hadn't been. So willful blindness, I said there was going to be some key takeaways here. Just so that you know, when we talk about being willfully blind, it's not criticism. Willful blindness is present in every part of our lives, yeah? In fact, we depend on it. Our social structures depend upon it. The taboos and the awareness of what we do and don't talk about, and what we deem discussable and what we don't, which is sometimes useful, by the way, not always, but sometimes useful. And I recall, I'm going to show my age here, but the adults in my life when I was growing up, they all used to use the phrase, don't talk about religion or politics, as if you couldn't talk about what the things that really mattered. I think if you're British, by the way, it's quite well ingrained. It's quite deep seated. We don't like to ask the awkward questions. But it is, it's present in every aspect of our lives. And one of the ways that you'll notice it's present is when you are watching the news. The news is providing you, it's a bit like Darren Brown, the news. This is not me being conspiracy, by the way. I don't mean that at all. But if you're watching the news, what the news is doing is presenting you what matters to the news and the editors of the news at that point in time. So what you're doing is it's holding your attention in one direction. You might want to look your attention in another direction. And I remember we hosted a couple of Ukrainian refugees about a year ago now, under the Homes for Ukraine scheme. And their constant criticism of the British news was that it didn't cover the Ukraine war in enough detail or depth. And they were saying, this issue needs raising, this issue needs raising. And so there was this sense that it wasn't being discussed in the ways that it should be, but actually being willfully blind to it helps people function. I know that might not sound like a kind thing, but being willfully blind to the things we don't want to see, it helps people function. When I go to London, I always notice the number of people. I take pockets full of pound coins for the beggars. Call me daft, and I'm fine with that. The reason I do that is I come from a very small town where we don't have beggars on the streets, so I can't reconcile it in my mind as the citizens of London can. And when I see people just walking past beggars, I kind of think, how do they do that? It's not that they're bad people, by the way. It's just they become attuned to it. They realise it's something that they need to do because they couldn't give away, as you know, they don't have, not all of us has a pocket of change in a little shelf that we can give away every now and again. So it's a naturally occurring phenomenon, yeah. It's a coping mechanism as well as a culturally influenced trait. And by culturally influenced, I mean it's influenced and shaped and evolved and developed by the cultures of the organisation that we work within. We are pre-programmed, yeah, this is evolutionary. We're pre-programmed to put our own safety and preserve our self-image first. Willful blindness actually is thought to date right back to the point of our evolution where we learn to cooperate and where we learn to work in groups. And the point of willful blindness was that if you saw the head of a group abusing somebody else, exercising power in a way that you didn't agree with, the worst thing you could do was put your hand in the air because you'd end up getting thrown out the group. And being thrown out the group in our primeval, state was that was a death sentence, by predation, by starvation, or by disease. So it's actually hard. This stuff is hardwired into us, to shut up and be quiet when we think we might either impact on our own physical or our own psychological safety. And we use it as a tool also to help us maintain our own self-image. Yeah, it's the image, it's the perception. So if you've ever been in a situation where somebody's made a terrible decision as a boss and then said, oh, it's just business. That was work. It's not personal. That's one of the ways that we sort of legitimize and we create a sense of willful blindness about aspects of our lives and our behavior. You may recall previously that we talked about respect and curiosity and humility. And we touched on this idea that I said it was a mantra worth noting that improvement begins with understanding. Yeah. And that was from the first session that we did. And once you understand willful blindness and ethical fading and you understand their significance, you can begin to address them. Yeah. And as leaders, as managers, as people, as individuals, even because you don't have to have a hierarchical position of authority to be called a leader, you can create the conditions in which they do not thrive. That's all our responsibility. Respect, curiosity, humility, those things are essential. I promised you a list of reading, and Jade, I think this will be on the slides that you send out. I appreciate giving you a list of 7 books is unfair. Everybody's busy. The 2 that leap out from me and there's lots I could have put on that list, by the way, lots and lots I could have put on that list. I've named the 2 as my top picks. Manageable chunks if you want to get into them. If you're an avid reader, go for the lot. Some of you might have already read some of those, but wonderful books, really enlightening books. Thank you very much for your time. I wanted to finish with a bit of time for discussion, and I'm in, as last time, I'm in no hurry to disappear. So I'll stop sharing my screen. Hopefully we managed to hold everyone's attention there. Apart from John, who disappeared. Shame on you, John. Not to worry. Yes. Well done. Thank you, Jay, for sharing the Derren Brown Gorilla Observation Test. Yes. Any thoughts from anyone? Anyone like to raise a hand or to share or to just shout out?
I can see that Joanne is. I can see Joanne's typing. Joanne, would it be better just to unmute? Okay. You need to go. All right, no worries.
Well, thank you, Joanne. Thank you for the feedback.
I need to bob off, but it was really fabulous once again. Thank you.
Thank you. Really appreciate that. Thank you.
Okay, what we'll do, Tom. Oh, there is a quick question. It's Anna. Oh no, it's Natalia. Let me bring Natalia in.
It's not a question. I just enjoy the session, and thank you very much. It's a lot of thoughts.
Oh, thank you. Thank you.
And I just wonder why this. I would say sessions are not widely used because it should be implemented in some corporate rooms just to make people realize what is important, I think, and what is the way of thinking, and it might change their behavior. Yeah, it's an excellent session. But I think it's all coming from humanity, because if you didn't grow inside and you didn't reach certain level of mentality, it's very difficult to see things what you're talking about. And it's where it's coming from. Yeah.
Thank you. I have tried to, with limited success, access the student scheme at the NHS Leadership Academy. But I think they have it's very focused, you know, in terms of what they get taught, and because I think you're right. I think it's the human stuff that matters, isn't it? And it's the human stuff that shapes. It's behavioural sciences and our brains that shape how we behave and respond and how we act and we think.
Yeah.
But those things
sorry for interruption, but I found that's also come from education, because if you are not educated enough, you've got a lot of fears, then you imperfections or quality you are perceived to be, you have as a leader can be exposed, and you're hiding more and you're afraid of changes and all this. So it is about right people in the right place and being dedicated from what you do. And as you mentioned, the fact about this kind of data, so we can't see because of so much information coming in. But what about these people who've got multiple leading positions, having family businesses around, leader of this, leader of that? I can't manage one simple things. And I look at this and they keep applying for more leadership roles. And I think, how do they manage that? So I think that is also incorporates all the problem, because in order to manage something well, you need to know something well, and you need to be in the center of it, and sometimes go from top to the floor to see and notice and speak people, and also require time, dedication, curiosity, and and the only one has a creature with one brain and one mouth and 2 ears, but I don't know how they do it all. They seem superhumans. And if you rely on personal assistance, it is the Chinese gossips, and it's information missing.
That's really. I'm laughing because I had an opportunity once. I'm not name dropping, I promise. I had an opportunity once to sit down with Robert Francis for an hour, or Sir Robert, as he's known. And I joked with him that the number of committees he sat on meant he'd clearly lost his way home, and his wife had forgotten what he looked like, because he was at that point. He was involved in 20 different organisations, and still getting called upon to do other things. And you're absolutely there is a point where you've got to look and go, really, is this good for anybody? Is it good for him? Is it good for us? Are we getting the best of him? Is he able to even give the best of himself? Because he's pulled in so many different directions. And you're right. I think it's nice to keep an open mind and to get involved in other things and to be creative and engage in other circles, isn't it? But I think to have your attention pulled so massively in lots of different directions, I think that's really difficult.
Yeah, it is. We are humans, and it's important to recognize our what we can do and what we can't. But it is required to be a big human, from the big letter, in order to be making decisions. Step down if you can't, and let somebody who can. But you're talking all about the right things. I wonder why it's not very wide. It's the first time in my life I can hear that somebody talking what does actually need to be implemented, not just talking. It should be a norm.
That's a wonderful compliment. Thank you. My head's about to grow. That's
fabulous. I'm just conscious of time, everybody. So it's just gone 3 o'clock. I hope you enjoyed today's session. The third instalment in this series will not take place now until the new year. So there's a short break over the Christmas period. We will send out some resources, the slide deck from today, some of the handouts that Tom mentioned that have got some easily digestible information on there, the key facts, no 300-page documents here. I've also popped in a link to our feedback survey for this session so that we can make some improvements for next time round. If you've got any, we'd love to hear from you. I've also popped in the chat box a link to register for that January session. I'm going to turn the recording off in a moment. We will stay on briefly until 10 past. We've got 8 minutes with Tom that's unrecorded if you've got any questions. If not, I'll share his contact details with you and hope to see you in January. Enjoy the festivities, everybody, if you're not coming on to another event until the new year. And it's been a pleasure to have you and Tom as well. Thank you.